So what would happen at a hearing test, you would come in, make the appointment beforehand, and then you would come into our office. We would have you fill out paperwork and kind of give us a thorough history of everything, and then one of the audiologists would pull you back. We'd kind of go over the history, kind of make sure you don't have like a family history of hearing loss, you don't have noise exposure, those kind of things. So we kind of ask you all those to kind of get a better idea of what's going on with your hearing loss. And then we would actually then from there go ahead and do testing. The case history is actually the most important part of the testing, just because we know exactly what test to do. But we always look real thoroughly in the ear, make sure there's nothing blocking the ear canal, make sure everything looks healthy there. We run a test called the tympanogram test and tympanometry, and it just checks to see how your eardrum is moving. So that tells us if there's fluid or negative pressure in that middle ear space. So we check the outer ear and then the middle ear just to see that everything's functioning anatomically the way that it should. And then we'll check the integrity of your nerves doing OAEs, which are just otoacoustic emissions. And then we move on to the actual hearing test. So we put headphones or inserts in your ears, and we play tones at different frequencies, at different levels to find your thresholds. And that'll tell us exactly where you're hearing as far as like an audiogram goes. And then from there we do some speech testing too, just to see how you're doing in background noise, and then also to check the integrity of your nerve as well. And then after all those tests, we go over results and see exactly where you are. No two people, even with the same hearing test, hear the same. So that's where we like to do the whole big picture of what's going on with that test. But that's kind of from start to finish what a hearing test looks like. After the test is done, we'll go over the results and talk about options for amplification if you do have hearing loss. So we talk about the hearing loss and how it backs up your case history and everything. Typically, if you talk about, I'm really struggling in background noise, that showed up in your hearing test. So we really get an idea of what's really going on with your test, and then we can fit you with amplification appropriately based on your test and the level of technology that would be best for you based on your lifestyles, and then also how you performed in your test as well. So we go over those results together, and we kind of come up with a plan together of what the next steps would be. Typically, if you do have a certain type of hearing loss, such as sensory neural hearing loss, we do go ahead and suggest hearing devices for the patient. In our office, we typically allot an hour and 15 minutes for the full test. Usually the actual hearing test portion that I was describing earlier only takes about 15 to 20 minutes from start to finish, but we like to have adequate amount of time to really sit down with the patient and talk through options and be able to fit that same day if they need it. That way they can walk out with a solution to their problem the same day that they came in with the problem. A lot of our patients have a whole lot of other medical issues going on as well, and so they're always real fearful of things hurting in our office. But really, the most that it would hurt would be cerumen removal, and that's not painful. It's just sometimes uncomfortable to have someone in your ear. But the actual test itself, it's just listening to beeps. I think the worst that could happen is you'd become bored through the beeps. But overall, it's quick and it doesn't hurt. There's no pain involved.